Ever had sudden, sharp pain in your lower back that seemed to come out of nowhere? You might be surprised to learn it could be from something as small and as painful as a kidney stone. Hi, I'm Dr. Mickey from the Health and Wellness team at Ubie Health. As the AI face of Ubie's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Today, we're diving into the not-so-fun world of kidney stones. These tiny mineral buildups might be small, but they can cause a lot of pain. If you've never had one before, consider yourself lucky, but also keep watching because about 1 in 10 people will experience one at some point in their life. So, what exactly is a kidney stone? Think of your kidneys as your body's personal water filter. They clean your blood, balance fluids, and flush out waste through your urine. But sometimes, excess minerals like calcium or uric acid stick around, and that's when trouble starts. These minerals can crystallize and grow into a stone. And what does that feel like? Imagine one of those sharp, jagged crystals trying to squeeze through the tiny tubes of your urinary tract. Ouch, right? People at higher risk for stones include those with a family history, individuals who don't drink enough water, and surprisingly, people in jobs where bathroom breaks are hard to take. So shout out to truck drivers, teachers, nurses, you're amazing, but you also need to hydrate and pee when you need to. Let me tell you about Maya, a patient who drives cross-country for work. She told me she drinks very little water during the day, so she doesn't have to stop too often. One day, she developed intense back pain that landed her in the ER, and bam, her first kidney stone. All of it could have been prevented with just a few small tweaks to her routine. So, what can you do to prevent kidney stones or reduce your risk of getting another one? First and foremost, water, water, water. Staying hydrated helps keep your urine diluted and flushes out those potential crystal-forming troublemakers. Aim for enough water to make your urine look light yellow, not dark or cloudy. Next, be mindful of your diet. Diets high in animal protein, salty snacks, and sugary drinks like soda can all increase your risk of stones. And while calcium supplements can be a contributing factor, interestingly, eating calcium-rich foods like low-fat dairy with meals might actually help bind stone-forming minerals and carry them out safely. Also, if you're taking vitamin D or calcium supplements, make sure you're doing it under the supervision of a healthcare provider. There's a balance. Too much can tip the scale in favor of stone formation. And if you're wondering about natural remedies, one that really holds up is lemon water. Lemons are high in citrate, which can help prevent calcium stones. Try adding fresh lemon juice to your water throughout the day. It's a refreshing and kidney-friendly trick. If you've already had a kidney stone, your risk of getting another one goes up significantly. But here's the good news. Most kidney stones can be prevented. Knowing your risk, making small adjustments, and staying informed can really make a difference. Worried about your own health? Start by checking in with a Ubie symptom checker at ubiehealth.com. It's medical grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. And if you found this helpful, don't forget to like this video and follow for more doctor-approved info you can trust from me, Dr. Mickey, and the whole team here at Ubie Health. Stay healthy and hydrated.